Good evening, everyone. It's my great pleasure to welcome you to Sunnybrook Foundation's Virtual Impact Series. Our focus this evening is on life's third act, those golden years earned after a lifetime of hard work, and a period of time where we should trust that if and when we need it, our care will be holistic, coordinated, and tailored to our specific needs. This evening, our expert panel will speak to Sunnybrook's leadership and exciting developments in seniors' care. But before we begin, however, please join me for a moment to reflect and recognize that many Indigenous nations have a long-standing relationship with the land upon which we work and live. Sunnybrook campuses are located on the traditional territory of many Indigenous nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, this land is home to many diverse First Nation, Inuit, and Métis peoples, and we are grateful to have the opportunity to live, work, and gather on these territories. Land acknowledgements are an important beginning to larger conversations and the actions that will advance Sunnybrook's deep commitment to reconciliation. Thank you. So tonight we're going to hear about Sunnybrook's holistic approach to seniors care, including the promise of the Peter Cipriano Center for Seniors Health that will realize our bold vision for integrated and innovative healthcare in the future. This future will build bridges where there are currently gaps in cares for our community seniors. Our three panelists tonight represent distinct area of care, but there are similar themes in their approaches. Key among them is coordinated care. This means the support for physical health, as well as mental, social, and emotional health. Now more than ever, Ontario's senior population grows, and we understand that there's true urgency to this important work. As a viewer and a donor to Sunnybrook, you are a vital partner in this call to action that we're currently taking on. So before we get started, let's start by meeting our panelists. It's my great pleasure to introduce them, and they will each take a couple of moments to share a little bit about who they are. First, we'll start with Dr. Sandra Herzig, the Research Director at St. John's Rehab Program.
Great. Thank you, Anna Maria. And it's a real privilege to be here this evening with such a distinguished panel. I want to thank everyone for attending. As Anna Maria said, I'm the Research Director and a Senior Scientist at the St. John's Rehab Research Program at Sunnybrook. I'm also an assistant professor at the Department of Occupational Science and Occupational Therapy and Rehab Sciences Institute at the University of Toronto. And in terms of my own research, I'm really interested in understanding the long-term outcomes that occur after someone sustains a life-changing illness or injury, and really trying to figure out what's needed to improve their quality of life. I have a number of projects focused on seniors' health and well-being, including the development of new models of care, which I'll be excited to talk about this evening.
Thank you so much. And now, Dr. Perla Hansing, Director at the Division of Dermatology.
Thank you, Anna Maria, and it is indeed a pleasure to be here. When we're talking about seniors' health, dermatology might not be the first thing that comes to mind, but I'm going to talk about that later, how we have a very large population of patients. I am an associate professor at the Division of Dermatology. I do only medical dermatology, and my special area of interest is immunodermatology, so dermatologic diseases that are mediated by the immune system. I'm going to touch on that a little bit later, and I'm really honored to be here.
Thank you. And Dr. Barbara Liu, Division Head, Geriatric Medicine at Sunnybrook, and Executive Director of the Regional Geriatric Program of Toronto.
Thanks very much, Anna Maria, for the opportunity to join you this evening. I'm a geriatrician, which is an internal medicine subspecialty looking after older adults. And I've spent my entire career here at Sunnybrook. I've been here for 27 years. I'm a professor at the University of Toronto and head of the Division of Geriatric Medicine, both at Sunnybrook and at the University of Toronto. And I hope to have the opportunity to tell you more about the different hats that I wear and the contributions that we make to providing care to older adults.
Thank you so much, everyone, for introducing yourselves. As we unfold, we have a series of questions that our panelists will address. but I encourage you all to use the Q&A function in the Zoom below to ask questions of your own. We can't promise that we'll answer all of them, but we'll answer as many as possible. And please enter them as they come to you throughout the session. To start us off, I want to hear from our panelists about what excites you about your work as it relates to seniors' health right now. And let's start with Dr. Liu.
Thanks very much. So many things excite me about my work, but what excites me the most as a geriatrician is getting to know older adults and their families and to hear about their life's experience and the wonderful work that I do, the privilege that I have to work with an outstanding interprofessional team that is dedicated to delivering care in a holistic manner. We're here to meet the needs of older adults, and in particular, those living with frailty, those with complex needs and multiple health issues. And we address goals and priorities that, as they are defined by the older adult and their family. We focus on function and quality of life rather than being driven by specific diseases. And the interprofessional team approach is something that was pioneered by geriatric medicine in the 1970s, 1960s. And it's gratifying to see that the rest of the system is catching up and also embracing this approach to delivering care that is holistic and delivered through an interprofessional team.
Thank you so much. Same question to you, Dr. Lansing. What's exciting?
I mean, this whole concept of interprofessional care is important, I think, not just for general medicine, but even in specialty medicine, which dermatology is part of. Really, for us in dermatology, I'd like to highlight two things that are kind of at the forefront of my mind when I'm talking about, care for older adults. The first one is skin cancers. Skin cancer is the most common cancer known to man. 1 in 6 people will eventually develop a skin cancer over their lifetime. And obviously, age is one of the most important risk factors for skin cancers. And so we certainly have a very, very large cohort of seniors and older adults in our practice in Sunnybrook dermatology who have skin cancers and often need either minor surgery that we can provide, but sometimes more complex care. And coordinating all those appointments can be tough. Surgery, if it's major, can be painful. It needs wound care. So there's a lot of interprofessional components to caring for someone after skin cancer surgery, and also preventative medicine for skin cancers as well. The other thing that I'm going to touch on is a topic that's kind of closer to my heart because it's an immune-mediated dermatologic condition. And so Sunnybrook has the largest cohort of immunobullous diseases in Ontario and probably all of Canada. And one of the immunobullous diseases we treat is a disease called bullous pemphigoid. And bullous pemphigoid is certainly something that is most common in adults over 65, so an older adult population. And this disease causes blisters all over the skin. And so patients who have this disease often need immunosuppression with steroids and other more complex drugs. And given the frailty of our senior population, the many medications that they're on, the many comorbidities, it is very, very challenging to treat this disease without interprofessional, good, holistic care. And so this is something that we are quite passionate about and are trying to move forward in the Division of Dermatology in Sunnybrook because of the special interest of our division in immunobullous diseases.
So both of you talk about coordinated care. Dr. Herzig, what does coordinated care actually mean, and why is it so important for seniors in particular?
Yeah, integrated or coordinated care is so critical because when we talk about a person's health, we're just not talking about their physical health or their underlying medical condition. It's really about understanding the whole person in terms of what their mental health needs might be, what their social situation is like, because all of these things come into play and can affect someone's journey through the healthcare system and their long-term outcomes. And when we talk about this, we also need to take into account the person's journey. So as Dr. Liu mentioned, in terms of having the interprofessional team really understand and come together to help the person figure out what is needed, we also need to understand that when somebody's receiving care at Sunnybrook, they may start off at Bayview campus, then come to St. John's Rehab or go to the Peter Cipriano Center for Seniors Health to receive additional care, and then they're back into the community. So it's really critical that we have supports to help people navigate sometimes a very complex healthcare system. So one of the projects that I've been working on is to evaluate this new pilot program, which is a patient navigation program for older adults with complex care needs. And this is a really interesting project because it's not just Sunnybrook involved in the mix. Sunnybrook has partnered with Sprint Senior Care, which is a community agency providing a number of services to seniors in the community. And what this navigator does, it helps the patient and their family members figure out what's going on when they're in the hospital, helps explains things, and then will even follow patients up to 90 days post-discharge from the hospital so that, as they are transitioning back to their homes, they'll have somebody to sort of guide them along the way and provide supports where needed to minimize any adverse events so that they don't have something happen to them in the community because they've been missed and then wind up back in the ER. So it's really been an interesting project, and it's really highlighted that these navigators are not only answering medical questions, but are also supporting patients with getting Meals on Wheels set up and figuring out if they have a family caregiver who can help support and make the appointments for them. Do they have a way to get to those appointments? And if not, connecting them with the right services at the right time so that they can get to where they need to go. And even doing things like answering some financial questions. One of the navigators was helping somebody figure out their bills at a home visit. So when we talk about integrated care, it's really about looking at the whole person, figuring out what their needs are, and putting those supports in place so that they can maintain their health and well-being over time.
Thank you so much. Now, it sounds like we're already starting to benefit from some of these innovations around coordinated and integrated care. Dr. Liu, can you share with us a little bit more about what the Peter Cipriano Center is going to bring to the community in the coming years?
Thanks, Anna Maria. So Dr. Hitzig highlighted several points about the importance of coordinated care. And older adults often have multiple chronic diseases and require the services of multiple providers. So having that integrated and coordinated care is essential to providing holistic care to optimize function and quality of life. Because an older adult, all people are more than their diseases. A major development on the horizon that is going to elevate coordinated care at Sunnybrook is the Peter Cipriano Center for Seniors Health. And this new center will allow us to create something truly unique in the city. I think it's probably going to be unique in the country. It will be a center that fosters collaboration both within Sunnybrook, with the world-class expertise that we have at Sunnybrook, and with our partners from outside Sunnybrook. So our collaborations and integrations will reach out through the partnerships of our Ontario Health team with community partners and other service providers. So instead of having an older adult come to Sunnybrook to appointments that may be happening in different wings of this very large hospital, we will bring the providers to the patient in the center, in the Peter Cipriano Center for Seniors Health. And that will make our approach truly person-centered, because it will be person-centered both in philosophy and in the physical design of the care that we deliver.
That's fantastic to hear about. Dr. Lansing, as a specialist, what does the promise of the Peter Cipriano Center for your practice area?
I think it's a very, very exciting concept. We treat, I'm going to go back to the immunobullous disease that I was talking about, the bullous pemphigoid. When we treat patients with that particular disease, they're often on high-dose steroids and other immunosuppressive medications and need a lot of monitoring. And as a dermatologist, we need the help of our colleagues. We need the help of geriatric medicine. We need the help of their family doctors. Sometimes we need the help of wound care. And so shuffling patients back and forth is very time-consuming and often ineffective in terms of access to holistic care. Like, for instance, I had one patient who, was in their 90s, had bullous pemphigoid. I needed to put them on high-dose steroids. And this is something that dermatology is a very, very much an ambulatory specialty. And so we treat a lot of complex diseases in an outpatient basis and on an outpatient basis. And we want to keep it that way. We don't want to admit patients unless we need to admit patients. And so I remember this patient of mine, their sugars went up, which can happen with high dose steroids. And this patient actually ended up in the emergency room and eventually in the ICU. Luckily, the patient recovered and is now quite stable and quite happy. But this is certainly something that we want to avoid. And I think we can avoid if we have faster access to the rest of the teams that the patient needs in the Peter Cipriano Center. So this is what the value, I think, of, coordinated care and, interdisciplinary care means for patients who have complex diseases and complex comorbidities and complex needs, which is exactly what the senior population has.
Thank you so much. I just want to go back a second to a comment that you made, Dr. Liu, and you referenced our community partners beyond Sunnybrook, and wondering if you might share with us what that looks like and the role that you have in that network.
So I think you're referring to the other hat that I wear as the executive director of the Regional Geriatric Program of Toronto. So Sunnybrook is a leader in the healthcare system, and many of the staff here wear different hats and serve in leadership roles in organizations and initiatives that extend out beyond the walls of Sunnybrook. And I've been very fortunate to have the opportunity to serve as the executive director of the Regional Geriatric Program of Toronto, the RGP. This is an organization that supports healthcare providers by sharing our expertise, driving quality, and building capacity in the system, so providers across the healthcare system can have an increased awareness of the needs of older adults and also have the confidence and the ability to address those needs. As the population is aging, unfortunately, we won't be able to catch up in terms of the number of specialists needed in geriatric medicine to meet the needs of all of the older adults. So what we try to do through the RGP is to share our expertise, to give away the skills and knowledge that we have, to share it through knowledge transfer, knowledge exchange, quality improvement, training, and education, so that the whole system can elevate the quality of its practice when delivering care to older adults. The RGP is a separate corporate entity that is hosted at Sunnybrook. And Sunnybrook had the foresight back in the 1980s when the RGP was first imagined, and Sunnybrook generously stepped up to host the organization as a resource to the system. And we have since then grown from originally 7 organizations partnering in the RGP to now 23 organizations. And we lead many system initiatives, including senior-friendly hospitals and senior-friendly care in the province of Ontario. And we do that along with our partners in other parts of Ontario as well.
Wonderful, thank you. And Dr. Herzig, can you share with us a little bit about the navigation and the role that plays outside of the Sunnybrook?
For sure. And one of the things I love about Sunnybrook and working here, I've been here since 2016, is really how much teamwork is valued. Most of my projects, I collaborate with people all across Sunnybrook, including Dr. Liu. I've had the fortune of working with on several projects. And it's really important that we have these partnerships, not only across Sunnybrook, but with the larger community where Sunnybrook is physically located. Because without those partnerships, a lot of this innovative work couldn't be accomplished. And it's really a testament and recognition that Sunnybrook is there when it matters, and that it's about building those connections outside of the community to really optimize our ability to deliver top quality care. So with the navigation project, again, without our partners at Sprint Senior Care, this project wouldn't have happened in the way that it is, where it's really bridging what's happening in the hospital all the way out into the community, where Sprint is providing services to seniors across a variety of living situations in their homes. Another example is, and some of these partnerships sometimes are quite expected. So one of our major partners are the City of Toronto, where we work with the Seniors Services and Long-Term Care Division where we help them evaluate and develop a new housing model for Toronto community housing, which is home to, which has 83 buildings designated for older adults or for seniors. And it's North America's second largest social housing provider. So seniors living in those homes have rent to gear income where 30% of their annual income is directed to pay for the rents, or they have subsidies. And unfortunately, many of the tenants, because they're low income, are disproportionately affected by poor health, social isolation, and other challenges that can make it difficult for them to live independently and to age in place. So by partnering with the City of Toronto, with Toronto Community Housing, we were able to come together with this new housing model that integrates both housing and health needs so that seniors could have services coming to their apartments and providing personal support work, again, Meals on Wheels, having nurses visit the buildings and provide services, because sometimes for older adults, it's hard for them to get out of their buildings, especially if they have a mobility impairment or some other disability. So again, it was great to partner with the city. And as well, we've also worked with them with some of their long-term care homes, where we've found new ways to implement new technologies, such as Wi-Fi enabled tablets to help the residents stay connected with their family members, and other innovative devices such as exercising machines with games, again, to keep people physically fit, mentally stimulated, and socially connected. So it's really been wonderful being able to bridge outside of Sunnybrook, across Sunnybrook, and come up with these innovative solutions to help seniors.
Thank you. Thank you so much. Now, we've heard a great deal about the need for coordinated and connected care and the network of caring that Sunnybrook is in the center of for our seniors. I thought maybe we take a few minutes to talk about helping people age well, kind of shift it a little bit, and think about some of that advice and lifestyle tips you'd give to those who are thinking about how to stay healthy and out of the hospital as long as possible. Sunnybrook wants to be here for you when you need us, but we hope you don't need us, is the way I like to talk about it. So Dr. Lansing, why don't we begin with you?
Okay, I'm going to start with something very, very concrete. So for skin cancers, let's say, the most common cancer known to man, I think sun protection is very important. It's never too late for sun protection. I think that's important. Prevention is always better than cure, right? But I think primary prevention and detecting skin cancers early is also another important thing. And I think as patients get older, as we get older, it's harder and harder to kind of check all of your body and be aware of these spots that might be changing. And, a regular check, a caregiver helping, check the back, let's say, or the scalp could mean the world of difference between something that can be excised in the clinic or maybe scraped off without stitches versus major surgery where we're talking about grafting tissue or losing an entire ear. So I think, that's one of the tips I think is just being aware of what's going on in your skin. Skin cancers are easy to spot if you look for them. And so, patients who are seniors or have mobility issues may need help from their caregivers or friends or partners to find these skin cancers. So I think this is the one tip I'm going to give, and it's a very simple and a very concrete one.
Thank you so much. Dr. Liu?
Thanks. I think to age well, we need to promote a healthy lifestyle early in life. I want to remind the audience that aging is something that doesn't happen just in your years after 65. It happens from the time that you're born. So having making good lifestyle choices early is the emphasizing prevention. But like Dr. Langsang said, it's never too late to start. So echoing Dr. Hitzig's comments, we emphasize being physically, mentally, and socially active. So being physically active doesn't necessarily mean you have to go out and get a gym membership and do exercise. Being physically active can mean just being less sedentary. So you may have heard people say that sitting is the new smoking. We want to limit the amount of time that people spend, prolonged periods of time that people spend sitting. So break up the time that you spend when you're watching TV or sitting in front of a computer. And there are new guidelines for activity that includes guidelines for people over the age of 65, that they should get enough sleep, that they should limit the amount of time that they spend in front of a screen. So limit the amount of time spent in front of the TV or computer for recreational purposes. They should do some physical activity that is considered moderate intensity for 150 minutes a week. And that time can be broken down into 10-minute aliquots. So it can be really small doses of increased physical activity that could be as simple as walking at a brisk pace. And so I think everybody can incorporate from wherever they are now, just increasing a little bit of physical activity and reducing the amount of time that they spend sitting. Being mentally active means doing things that are new, something that you're learning. So not just staying in the same routine all the time. So stimulating the brain by learning new things. It could be a new skill, a new hobby, learning a new language, doing things differently, reading about something, but then writing about it, or discussing it with a friend or a family member, sharing information, doing puzzles, just trying something different from your usual routine. And then the last thing is being socially active. And that means having meaningful social engagement is the key to combating loneliness. We've heard a lot about loneliness through the pandemic, which can have negative health effects. But it's important for people to recognize that it's possible to feel lonely while you're surrounded by people. And it's also possible to be alone, but not feel lonely. So it's meaningful social interaction is what is important for people to focus on in terms of what they need in terms of health benefits.
Thank you. I think we can all relate to much of your comments, especially after the last couple of years. And I do feel compelled to stand up for a moment and sit down again, but another 33 minutes. Dr. Hitzik, over to you. What advice do you have for those who want to age well and healthy?
Yeah, the social piece is so critical. Again, as everyone is well aware, and we've talked about, COVID pandemic has given us all a little bit of a taste of what it's like to be socially isolated. But even before the pandemic, social isolation, especially for seniors, was recognized as a silent epidemic, and it was recognized as being a silent killer in some cases. There are a number of studies that showed that, staying on this, the smoking example, that feeling lonely or socially isolated is as bad as smoking 15 cigarettes a day, or being physically inactive, or even being exposed to high levels of air pollution. There are several studies showcasing the negative effects of it. So, I mean, especially if you're sitting, try not to do it when you're alone, or if you're alone, try not to sit. It's really critical that you reach out to people, especially if you are starting to feel a little bit blue or lonely, and especially for people who may have a mobility impairment. I've done several studies where people with limb loss, who've lost a leg due to complications from diabetes or vascular disease, the majority of whom are older adults, had really high rates of social isolation, of living alone or having small social networks, which are the characters or people in your social life who are there to provide you with social support, and it really had a significant impact on their health and quality of life. So again, it's really important that if you can, call relatives, if you can't get out of your house, and screens are not always the best, but even picking up the phone or doing a face call with somebody, just to let them know how you're doing, and vice versa. Staying connected through groups, exercising with others. So, even if you start this earlier on in your life and you have a workout buddy, that's a great thing that you can do to incorporate into your daily routine. And really, the more that you're able to keep an eye on your social health, it'll have a number of physical and mental health well-being benefits. And I would just really stress that part. If you are unable to, let's say, physically exercise vigorously or be able to get out of your home, try and stay connected.
Thank you. Thank you so much. Now, we are going to be turning to questions from our audience shortly. Just a couple more that I want to give our panelists a chance to respond to, but I do encourage you to please enter in your questions to Dr. Liu, Lansing, and Herzig in the Q&A function on the Zoom. Thinking about our audience this evening, great advice for all of us, really, but for those who want to think about aging well. Wondering if we might take a few minutes for sharing advice and counsel or tips with our caregivers. Many of us this evening are probably thinking about our aging, but also thinking of aging parents, aging loved ones, aging friends. So hoping, Dr. Liu, that you might be able to give us some insights for caregivers.
Mm-hmm. First of all, I want to acknowledge that caregivers make an enormous contribution to the care of the individual person that they're caring for, but at a system level, there have been many studies that have measured the contributions of caregivers in a dollar figure, and it's just insurmountable. Without caregivers, the system could not function, and we could not move forward. Caregivers most often are looking for help for the person they're caring for. But the thing I want to remind them of is that they need to care for themselves as well. So you have to be physically well enough to provide care, and you also have to have the emotional stamina to be a caregiver. And there are resources available for caregivers. There is the Ontario Caregiver Organization, the OCO, and it has a 24/7 caregiver helpline to provide support to caregivers. They put on several webinars and have a myriad of resources that are helpful for caregivers that are available through their website. And this is an organization that is funded by the government. So I think it's a good signal that the government did recognize the incredible contribution that caregivers make to providing care to, especially to older adults. And once again, I think that looking after yourself as a caregiver, you can't do it by yourself. So you need support, peer support, as well as help from organizations like the OCO and other organizations that may be specific to the disease of the person that you're providing care to, may also be helpful to you.
Dr. Lansing, did you want to add anything to our caregivers?
Yeah, I completely agree with what Dr. Liu says. Being an ambulatory specialty, many of our patients, especially older adults, could not come to their, let's say, monthly appointments without the help of caregivers. So they for sure play a very crucial role in allowing us to provide the care that we need to give our patients and keep them out of the hospital. And I agree, many caregivers oftentimes forget their own healthcare, actually, because they're so busy with providing care to their family members or friends who need their help. So I really appreciate that sentiment of you cannot care for others if you don't care for yourself first.
Thank you so much. So one last final question for you this evening before we turn to our audience. And I've been sent a note that I failed to introduce myself at the beginning. My name is Anna Maria Hobro. I'm the Vice President of Advancement at the Sunnybrook Foundation. And our team is those that help to translate the gratitude of many of our patient families to advancing the mission of the work at Sunnybrook, and by these three individuals here today. So I just want us to take a little bit of a moment here. And Dr. Liu, how can our audience support your work? What can our donors do to advance seniors care in Toronto and Canada and beyond?
Thanks, Anna Maria. Through this evening's conversation, we've highlighted the importance of coordinated and integrated care, and the Peter Cipriano Center is going to elevate and improve how we care for seniors in our community. Donor funding is critical to establishing this transformative center that will be unique in Toronto, if not unique in Canada. It will improve continuity of care, it will improve the quality of care, and it will also serve as a hub for research and training the next generation of healthcare professionals who are all working towards our goal of leading and transforming the future of healthcare for seniors. We are very fortunate to have had several lead donors who have already committed to help us establish the Peter Cipriano Center for Seniors Health Care, and we will continue to build from this foundation. We continue to seek support and encourage our community to find out more about this visionary center for seniors care at Sunnybrook, a center that will be providing care for you and your family and your loved ones in the near future.
Thank you, Dr. Herzig. And anything you'd like to add to the impact donors can have in your area?
Well, first of all, we're so grateful to all of our donors for supporting, us here at Sunnybrook. As a researcher, I'm especially grateful. Sometimes it can be very challenging to find external funds to support some of the work that we're doing. But when we do get that investment from donors, it can really lead to innovative, life-changing programs and ideas that we really work hard to translate into regular clinical practice. For example, the Sprint Senior Care Patient Navigation Project that I talked about, this program is supported by the Slate Family Foundation, so it's through donor funds that this pilot project is possible. And what we're trying to do is evaluate it and get the necessary data so that it can be sustained long-term at Sunnybrook and hopefully be transported to other healthcare centers across Canada so that other seniors across the country could benefit from patient navigation. At the same time, whenever I get these donor funds supporting our work, I really have the mindset of trying to show that return on investment so that it either leads to a larger project so that if we get if we get some donations that we're able to apply for a larger grant to expand that work. And just to, echo what Dr. Lou was saying about the next generation, as I get older and maybe entering my third act down the road, I want to make sure that there's, young, bright people taking on the work and doing the research and other things necessary to support, my health care needs. So again, through the navigation project, we were able to hire a postdoctoral researcher who was funded through that project, but then she was able to apply for several other awards and brought in more money to that project and was able to sustain her position. So it's all about taking what donors are giving us. It's not only their funds, but it's their belief in that we're going to do the best things possible to really help grow clinical care research at Sunnybrook in order to meet all of our patients' needs. So, just really grateful for all the donor support over the years, for their trust and partnership in inventing the future of healthcare for seniors.
Wonderful. Thank you. So we're going to turn to our questions now, and please keep them coming. The first one, over to you, We'll come to you, Dr. Lou. Why is the need so urgent to prioritize coordinated person-centered care for seniors?
Well, the population is aging, and as I mentioned before, we focus mostly on older adults with frailty, living with frailty that also have complex health needs. And so for that population, coordinated care is critical. Unfortunately, the way our system has been built, it really wasn't designed intentionally with the needs of that population in mind when many of the systems and structures were put into place. So we do have good components of healthcare available in our healthcare system. What we really want to do is bring them together and create synergy between them in order to achieve the impact and the outcomes that they were originally designed to achieve. But unfortunately, when operating in silos, some of that impact is dissipated and it's not realized to its full potential.
Wonderful. Thank you. Any lessons in particular that you have been able to incorporate in your work with seniors from COVID and the pandemic experience?
Sorry, is that for me too?
Oh, I'm sorry. Let's start with Dr. Herzig.
In terms of incorporating lessons. So I think one thing that became very apparent from the pandemic is that it didn't hit everyone equally. especially if you're an older adult. At the City of Toronto, again, seniors living in Toronto community housing, we're having challenges getting access to services. We're going into crisis. And sometimes these are people who were from low income, from communities of color, from the 2S LGBTQ plus community. So in terms of my own work, it's really highlighted the importance of understanding what the health needs of seniors from those equity deserving groups might be. We've always had an eye on those issues, but I think these inequities were really exacerbated by the COVID-19 pandemic. And we've really strived to collect that type of data to understand how people are navigating the healthcare system. And again, especially if you're a senior and you have already facing a number of challenges because you might be in poor health, you have poor mobility, and then you add in another factor such as your socioeconomic background or your sexual orientation, that can make things much more complicated. So the COVID-19 pandemic has really inspired me to take a closer look at older adults from these groups and to collect meaningful data so that we can inform ways to address them moving forward.
Yeah. Dr. Lansing, did you have anything you would like to add to that question?
I think in dermatology, particularly what the pandemic taught us is that virtual care is a double-edged sword. You know, it is a great way to provide care, but at the same time, dermatology, we have to see things in order for us to assess them properly. And we certainly saw a whole number of patients where, you know, the skin cancers that we would see were just 3-4 times larger than what we would have seen before the pandemic. And that's the very sad reality of not being able to come and access care when you need to access care. And so we were dealing with a lot of complex surgeries, making sure patients, you know, help getting our plastic surgery colleagues, our ENT colleagues. And so it was a lot of coordination and shuffling patients around, really, because we can't all do that in the clinic. So that was really eye-opening for us. I also wanted to add that, you know, I think the COVID pandemic also kind of made us realize that medical dermatology is sort of in crisis mode. There were very few of us who were really, you know, seeing very sick patients during the pandemic. And dermatology has never been kind of at the forefront of complex medical diseases. But in Sunnybrook, we are fortunate that we have such a great group of supports from, you know, our colleagues in medicine and plastic surgery and all of that, that I think we just saw how easily we could get overwhelmed by just the volume of patients and the complexity of care that the patients needed.
Yeah, it'll call for different kinds of planning as we think about an aging, growing population, certainly. Dr. Liu, this question is perfect for you. Are seniors today in better health than they were 20 years ago, given our awareness of lifestyle and diet?
Yes. So the life expectancy in Canada and in other parts of the world as well has increased continuously over time. And I think that reflects advances that we've made both in understanding lifestyle, appropriate lifestyle choices, but also advances in cardiovascular disease management as well as cancer management has shifted prognosis and longevity significantly.
Wonderful. Thank you. So something for all of you to think about for a moment, and we'll ask Dr. Hitzig to comment first. What is something you've learned from a patient that you bring to your clinic or your research practice?
I learned so much. One of the things that I really enjoy about working in research at Sunnybrook is that a lot of our projects are done in partnership with people who have experience or people who were patients, so people with a disability or have been through the healthcare system, where we really work to try and identify shared priorities, where we've had meetings in the past and said, you know, what's important to you? What are the types of issues that you would want us to research? And we managed to build some really lovely collaborations as early as the grant writing phase, where we have patients on our investigation teams giving us input in terms of what we should be asking what they want the research to accomplish, and then pushing us to make sure that whatever we learn, in my day, it would have sat on a dusty bookshelf in the library. Nowadays, not to sit as a PDF on a file on a computer somewhere, but really try to get those research findings mobilized and into action, because we really need to not just sit and research and say, that's great, we learned something, but how do we actually make meaningful change? And again, working in collaboration with different agencies, different groups across Sunnybrook, community advocacy groups, we really try and co-create solutions to meeting the needs of patients. So it's really been a wonderful experience just collaborating with patients over the years on different projects. So that's been really meaningful to me.
Dr. Lansing, anything you'd like to add?
Mine is very, very personal. I think dermatology, especially medical dermatology, is chronic care, meaning we see our patients almost monthly, really, for years. And so to me, the most joyful thing that I've learned is just learning about the life stories of my patients, and the wealth of wisdom and experience that especially older patients bring to our appointments. That's really been a very fulfilling thing for me. I run a skin cancer clinic at the Veterans Wing once a month. And so my grandfather was a World War II veteran. And so that's been a really personal thing for me to do. And so aside from the systems things that we've learned, it's also personal learning and personal fulfillment on my part.
Thank you so much. Dr. Liu?
Yeah, so learnings from my patients, over 27 years of practice, I think the most important thing is to remember to listen, that the patients can tell me what they need and how I can best help them, as opposed to me defining what that help looks like. So remembering to listen. The other thing that is very important is the language that we use. And so medicine is, I think, a little bit behind in how it is adopting person-centered language, and the types of words and terminology that we use when describing patients and their symptoms in their charts, in their documentation, and in our communication with each other as professionals can flavor can flavor our opinion and our management plans. And especially when it comes to older adults, ageism, I think, is pervasive in society as well as healthcare, and it's often unrecognized. And so that unconscious bias can sometimes impact us in the healthcare system. And so to be aware of the language that we use, and to also just be aware of the fact that we have unconscious bias, be aware of the fact that it's unconscious, and that we always have to be active in trying to keep it in check.
Thank you. I have another question for you, Dr. Liu. You spoke about the Cipriano Senior Centers, the place where we would come for patient-centered care. Why is it important to keep our seniors out of the emergency department?
So similar to the response that I gave previously, is that the emergency department was not designed to be a senior-friendly environment. It was designed for something very different than what the majority of seniors present with in the emergency department. It's a very overwhelming environment. It's very fast-paced. The physical setup is not conducive to the sensory challenges that many older adults have in terms of the lighting, the sound, the bed mattress firmness, the height of the mattress, and being able to get out of that stretcher and then into a chair or over to the bathroom. And the systems that we have in place for how we deliver the care in the emergency department is not tailored to the needs of older adults. So I'm not saying don't go there. There are times when you do need to go there. When you have acute illness that needs to be addressed in a hospital, you do need to go there. But if there are other opportunities to try to prevent going to the emergency department through your community care providers, through primary care, the onus is really on us as those providers to make that care possible. And we really need to look at more upstream solutions to prevent people from needing and feeling that that's the only avenue for help. being the emergency department, we need to shift the investments that we make in the healthcare system, as well as how we work together to make it possible for older adults not to need to come to the emergency department, because nobody wants to go to the emergency department and have to wait and to be so uncomfortable. And sometimes people leave worse than when they first presented because of that.
Thank you. And I have another one for you, Dr. Lu. Oh, one moment, please. Okay, sorry. I'm going to read every word of this one because I don't want to get it wrong. At what stage of life should someone see a geriatrician? How does one go about getting a geriatrician? How do they work with your GP, or do they replace your family doctor? How does one get a referral? We get to be your patient, Dr. Lu, I think is what people want to know.
We get this question a lot. So in Canada, geriatricians work as consultants to the primary care physician, which is different than how they operate in the United States. There aren't enough geriatricians for geriatric medicine specialists to take over care from the primary care physician. So you need to have a referral from your primary care doctor to see the geriatrician. And generally speaking, people come to see the geriatrician when they have some of the syndromes, what we call syndromes, associated with aging and aging with frailty. So problems with memory or thinking clearly, problems with mobility or falling, problems with managing activities of daily living, going to the bathroom, maintaining nutritional status, and sometimes also mood disorders. So when people's function starts to decline and you're not sure why, it's not clear that it's because you're having something wrong with your lung or something wrong with your heart. If you had something wrong with your heart, you would go to a cardiologist. But when things start to decline and you're not sure why, that's often where the geriatrician can help provide an assessment and some guidance in terms of management. Often in those situations, it's not a single reason why that decline is happening. And the management plan is also usually not just a single intervention. Hence, we need to have those coordinated systems in place because it requires many service providers to provide the solutions that are needed. Because as Dr. Hitzig said, sometimes it's a change in nutrition, housing, other things that are impacting a person's function beyond just diseases and organ-specific interventions.
Wonderful. Thank you. Now, I think we have probably just time for one last question. And we've lost visual of Dr. Hitzig and sound. I hope he's okay there. Any advice that you have around how people can advocate and coordinate and navigate for themselves, and how best to engage their physician to participate in conversations to advocate for their needs? I know we talked about Sprint, but it's hard. It is a hard thing to do in the Canadian system. And what advice do you have for folks when they're self-navigating and advocating? Dr. Hitzig, do you want to, any thoughts you'd like to share? And we only have about a minute left. So
I only caught part of that. Unfortunately, the internet gods aren't being kind. I don't know if you can hear me.
Yes, we can. We're looking for.
Can you hear me? Okay.
Yeah. Dr. Lu, do you have any advice for folks as they work to advocate and navigate the system for themselves and their loved ones?
Yeah, if possible, to educate yourself, to look up information, and I think you need to be critical about the source of that information. You have to go to a trusted resource. Many people turn to the internet for information, and then unfortunately there's a lot of stuff on the internet that is not reliable. So Sunnybrook does have some excellent resources that are targeted towards the public and families and older adults. The RGP, the Regional Geriatric Program of Toronto, we also have some resources available. And in particular, we have some resources that are a guide to what information or questions might you want to talk to your doctor about when you have things like memory concerns, or you're falling, or your mobility is being compromised. So being informed and equipping yourself with information and raising those questions at your appointments early in the appointment as opposed to at the end. So like what I was saying before, listen to your patient. Sometimes, unfortunately, the doctors or the health professionals don't always do that. And they spend a lot of time talking in the appointment. And then at the last minute, they say, do you have any questions? Well, and then you're asking these questions just as your appointment is about to end. So try to raise those questions early in the appointment to manage your time with your health professional most effectively.
Excellent. Thank you. Now I just want to slip in one last question. Can you hear us, Doctor? It's excellent. I'm going to be grateful that the internet gods only came choose to turn on us at 6:54, not earlier this evening. That's very helpful. Just very quickly, talking about staying connected and volunteerism. Questions about the opportunities to engage in volunteer programs at Sunnybrook. And I thought you might just take a moment to share about the special volunteers that are at St. John's.
Oh, we love our volunteers at St. John's Rehab and of course across all of Sunnybrook. It's a wonderful group of individuals who run our coffee bar for our patients at 3 p.m., who run our gift shop, who even before the pandemic were helping several of our patients with their meals, doing a number of important things of sort of building that sense of community at the hospital. Our volunteers fundraise for us. They're our biggest cheerleaders, and they do such important work by really building that sense of community across all of the hospitals. So I think volunteering, again, is a wonderful way to stay socially connected. I often see our volunteers, chatting, having a great time, being engaged, being social, and doing something meaningful that may seem small, but is really can have a large impact on some of our patients' lives and well-being, be it a small conversation or a kind act of just helping somebody with something small. So it's just volunteerism is a great way to stay connected, a great way to give back, and we are definitely very grateful for all of our volunteers.
Wonderful. And you can find information about volunteering at Sunnybrook on the Sunnybrook website. So thank you, Paul. So here we are. It's time for our evening to draw to a close. I want to thank Dr. Lansing, Dr. Liu, Dr. Hitzig for joining us this evening. I take great privilege and pleasure in working with all of you. And we're just so grateful for your continued support of events like this to come and share your knowledge with our close friends and supporters. As you heard, Sunnybrook is already supporting seniors for life's third act, and there is still more we can and we must do. The Peter Cipriano Senior Center, or Center for Seniors Health, is going to set the new standard for high quality coordinated care for seniors in our community. It'll be a hub of research that will transform the health system. And this exciting future is possible because of the contributions made by donors like you. We are continuing. We're just so very grateful. And we thank you for helping us support our esteemed colleagues in the work that they do to support our community. This evening was our second virtual impact event for this year. Our third and final for this season will be on March 7th, where we will be discussing women in brain sciences and hear from many of our most celebrated leaders in the Herbert's Brain Sciences program. I hope you're able to join us, and I'm so very grateful you joined us this evening. Thank you very much. Good night.